Cambodia was once one of history's greatest empires. It has the world's largest religious monument, Angkor Wat, a Hindu temple built centuries ago. Though this country in Southeast Asia may look beautiful, its poverty and pollution put it in a different light. Its ancient splendor is long gone, and it is now a poor country. The average income, $1 a day. Many people don't have good, if any, health care. The average lifespan is 63 years old, and nearly 1/3 of Cambodian kids under the age of 5 are underweight. Another problem is that the government is corrupt. The doctors in the public health system are supposed to provide free care, but they often charge money that Cambodians don't have. Dr. Richner, a Swiss pediatrician, began building children's hospitals in 1991 with money donated by foreigners, mostly from his native Switzerland. The 5 hospitals have dramatically increased the number of children treated. At his hospital in Siem Reap, called Kantha Bopha, people wait for hours to get free medical care. It has hundreds of beds, but it often gets so full that some kids are placed on mats on the floor. USA Today reporter Wendy Koch interviewed Dr. Richner.
Here, 90% of people are poor. The children, 80% of the children are hospitalized. In our hospitals are children from families with a daily income of $0.5. And these children should have the right to be treated in the correct way. So the hospitals must be free of charge, all treatment. And the biggest difficulty in Cambodia in the daily work, you have a huge corruption in the Cambodia on all levels. And our hospital is since beginning free of corruption. So you must be vigilant, you must be not sleeping, you must have your eyes and you must feel the things. Fortunately, we have no corruption. Because if you have in the system of the hospital corruption, the poor is excluded from a correct treatment. They only treat the rich when they get the money under the table, as it is the case in all the government hospitals, in the provincial hospital, district hospital, in the health center. So these were the big problem.
Many of the children suffer illnesses that are no longer common in the United States. In Cambodia, the tap water isn't safe and the air is polluted, so kids get terrible illnesses such as dengue fever.
One big problem, especially now, is the dengue fever. It's a virus transferred by a mosquito, and is for the child can be for the child a very severe disease. The vessels are destroyed, and so the child is losing liquid, gets to be in shock, and if this shock is not treated, this will be the hemorrhagic shock. And we have a lot of dengue cases at the moment. We have all the time about 400 dengue children hospitalized. And every day 150 up to 200 new cases to hospitalize.
Here's a girl with dengue fever. This video might be disturbing to some viewers.
Because they are treated in the wrong way. Yes. Yes.
Many other children have tuberculosis, an infectious disease primarily affecting the lungs and spread by airborne bacteria. Also common, malaria and Japanese encephalitis. Often the kids come to the hospitals to get free medicines and shots so they don't get sick. If they need to stay in the hospital, a parent, usually the mom, stays with them the entire time, day and night. This is Grace Keenan.